Cosmeceutical Magic, Banishing for making me a, thank you for making me a part of this brand presentation instruction course. My topic for today is Cosmeceutical Magic,
Can you please raise the
Banishing
volume?
Periocular Wrinkles and Dark Circles. There are no financial disclosures for this presentation. So when we are looking at repairing an building which has weathered the time of storm, weather, age, we look to restore its structural integrity, which includes basic framework. We do minor repairs, but that is what makes a lasting impression. That is something which really contributes to making it look rejuvenated, refreshed, new. And this is what today's talk will be about, restoring this facade and maintaining it with some over the counter medications known as cosmeceuticals. So, if you go to a supermarket and look in the shelf, you'll find a wide variety of skincare products which are easily available without prescription. The major category of these includes the sunscreen. Then you have some peptides, which are supposed to be the actives or the bioactive compounds which bring about a change in the skin texture, color, tone, address common skin concerns. And other ingredients like multivitamins, ferulic acid, retinoids, and peels, which help in restoring this facade of the skin and making it appear youthful and supple. In short, all these products are available in a jar on the shelf in the supermarket. So the term exactly what does it mean? It was introduced by Albert Kligman in 1984. So cosmeceutical actually means products which are known to exert a biological action but regulated as cosmetics. So when these cosmetics come into the regulation for these is not as rigid as the pharmaceutical products. They are articles intended to be rubbed, poured, sprinkled, or sprayed upon. That means they remain outside, they're not invasive, they remain on the surface of the skin, and they can be applied to the human body for cleansing, beautifying, promoting attractiveness, or altering the appearance. Compared to this, a pharmaceutical drug is a substance which is intended to affect the structure and function of the body. Here, another term comes in, which is the nutraceutical, which is like a cosmeceutical but is introduced inside the body, that is, it's ingested. So, most of these products are contain generally recognized as safe ingredients. There's an ingredient review board which lists the chemicals that can constitute a cosmeceutical and can be marketed in the supermarket rather than the pharmacy without requiring rigorous trials before it's launched into the market. Because of this reason that the trials are not really done for them, there's a tendency to dismiss these as ineffective as the regulation is limited, but actually they may have a lot of potential benefits, but they're just not studied. So we have to rely a lot on clinical data as well as the data provided by the manufacturers as to how much efficacious they can be, and also delve into them, see your own experience. So, what all concerns can these cosmeceuticals address? They can address periocular pigmentation, they can address the fine lines and wrinkles, which are quite bothersome and may present to your OPD as the patient is seeking periocular rejuvenation. Coming to the categories individually, the most important of these for the periocular region, along with the sunscreen, I always recommend sunglasses. The next would be the retinoids, out of which the least potent retinol is available in a lot of these creams, anti wrinkle creams over the counter, and this is considered as a cosmeceutical. Then you have the neuromuscular relaxants and peptides, which include your arginine, Vialox, Leuficil, DABA molecules. And if you look at the shelf or if you look on Google, almost all anti-wrinkle creams contain one of these compounds designed to act like a Botox and reduce the neuromuscular contraction and reduce the fine lines and wrinkles non-invasively by applying them topically. Some results are noted with these products as long as the patient continues to use them regularly. The next is products specifically targeting hyperpigmentation, which can be either via masking or by reducing the melanin appearance or the production, that's by the tyrosine kinase pathway. And the main products in this include the hydroquinone and azelaic acid, which are prescription based, and the cosmeceuticals like arbutin, licorice, vitamin C, and kojic acid. Keratolytics, which are the alpha and the polyhydroxyl acids, which basically increase the skin turnover time by removing the epidermis and allowing the dermis to shine through. The new layer of the skin, which comes after the application of these, is supposed to be uniform and appear more glowing, and the texture seems smoother. The other advantage of keratolytics is it improves the absorption of the other product categories by removing the top layer of the skin. Then we have the antioxidants, vitamin C, E, resveratrol, which is available in topical formulations. Then we have some growth factors which can be plant or human based. And then we have barrier function, that's repair creams like your moisturizers, ceramides, urea, and hyaluronic acid. Combinations are supposedly more effective when used wisely. Also, there's a significant ease of use because there are lesser number of creams to apply. However, if a patient is allergic to one of them, then we need to stop the entire combination because we cannot really pinpoint which product the patient developed allergy to. A common example which I like is for the periocular pigmentation, a vitamin C with an E cream, which has a double action when combined. And if you add to it the ferulic acid, it leads to increased absorption in the periocular region with dramatic improvement in the appearance of dark circles. The last topic that I'll be touching will be the eyelash and eyebrow growth serums because many patients do come in asking whether these are safe for the eyes, doctor. I've heard they're made from an eye drop. So we do have prostaglandin based analogs which are in these serums like the bimatoprost, latanoprost, but we also have PG free products which contain castor oil, and they do lead to some improvement in the appearance of the thin hair by making them thicker, increasing the density, increasing the growth. But yes, be cautious when you're using them. For example, we are all aware about the prostaglandin analog and the lipodystrophy around the eye. So we should be cautious when we're using them and always counsel the patients regarding possible side effects and when to report back. With this, I'd like to end my talk. Thank you very much for your patient listening.